Hello, my name is Cecilia Covarrubias. This is my signature assignment, and I chose the hormone thyroxine. This is an image of the chemical structure of thyroxine. We'll get into a little bit more detail about it coming up. The chemical formula for thyroxine is going to be C15H11I4NO4, and its molar mass is going to be 776.87 grams per mole. Some more on the thyroxine structure. It's composed of two tyrosine amino acids, which is C9H11 and O3, with two iodines covalently bonded to each. Here's another more detailed look on thyroxine, just to kind of reflect what we learned on chapter 11 for organic. This is like going to be an organic compound because of all the carbons. You can see that they're cyclical in nature. And then to really kind of like maintain that octet rule, you see that they have some double bonds right here. And then you have hydroxyl right here, hydroxyl right here. You have a methyl right here, and then ammonia group right here. And then, as mentioned before, you have two iodines connected to each. So 1, 2, 3, 4. And then we also have a hydroxyl group right here. And then the chemical properties, the boiling point is going to be 576.3 degrees Celsius. And then the melting point is going to be 235.5 degrees Celsius. So thyroxine is made up of covalent, ionic, and hydrogen bonds. It's nonpolar. It's a lipid-soluble hormone that travels through the blood attached to plasma proteins. And then it is hydrophobic. And here I attach the definition of hydrophobic. It's nonpolar substances to aggregate in an aqueous solution, and they exclude water molecules. So thyroxine comes from the thyroid gland, and it controls the body's metabolism. So how it's kind of synthesized and how it works is the pituitary gland and the hypothalamus collaboratively trigger the thyroid gland to produce T3 and T4. To kind of not confuse everybody, here's an image of kind of how the process works inside the thyroid gland. It's going to be like a collaborative effort between TSH, which is thyroid stimulating hormones, T3, which is going to be triiodithyronine, and T4 is going to be the thyroxine. So going to go back to the slide, I guess. Once your thyroid releases thyroxine, T4, into your bloodstream, certain cells in your body metabolize it into T3 through an exothermic process called deiodination. This is because cells have receptors that receive the effect of thyroid hormone are better able to use T3 than T4. Therefore, T4 is generally considered to be the inactive form of thyroid hormones, and T3 is considered to be the active form of it. As far as testing, normal ranges for thyroxine, total T4 tests measure bound and free thyroid hormones in the blood, and a normal total T4 level in adults ranges from 5.0 to 12.0 micrograms per deciliter. So we kind of mentioned earlier that the thyroxine hormone synthesizes in the thyroid. But cells that can convert T4 to T3 are found in the liver, kidneys, muscles, in the thyroid, like mentioned before. It's also in the pituitary gland, like mentioned before, and then brown adipose tissue in the central nervous system. Thyroxine affects the cells and all the organs of the body by regulating our metabolic rate, our heart rate, our body temperature, brain development, muscle contractions, and skin and bone maintenance. So you might be asking what happens when there's too much thyroxine. Too much thyroxine in the bloodstream is also known as thyrotoxicosis. This is caused by overactivity of the thyroid gland, which is hyperthyroidism or Graves' disease, which is inflammation of the thyroid or a benign tumor. Too much thyroxine can also lead to thyroid cancer. Hypothyroidism and thyrotoxicosis can be recognized by a goiter, which is a swelling of the neck due to enlargement of the thyroid gland. As you see in this image, the neck is pretty swollen. You can kind of see like there's a goiter, it's really swollen up. And then symptoms of hyperthyroidism include intolerance to heat, weight loss, increased appetite, increased bowel movements, irregular menstrual cycles, irregular and rapid heartbeats, palpitations, tiredness, irritability, tremors, hair thinning, and hair loss, as well as retraction of the eyelids. So you may be asking what's happening to the body when there's too little thyroxine. Too little production of thyroxine by the thyroid gland is known as hypothyroidism. Hypothyroidism may be caused by autoimmune diseases, poor iodine intake, and use of certain drugs, and then sometimes the cause is even unknown. Thyroxine is essential for physical and mental development. Hypothyroidism before birth or during childhood can cause mental impairment and reduce growth when left untreated. And hypothyroidism in adults causes reduced metabolism, which consequently can result in symptoms such as fatigue, intolerance of cold temperatures, low heart rate, weight gain, reduced appetite, poor memory, depression, stiffness of the muscles, and reduced fertility. How to be diagnosed with thyroxine? They're all obtained through blood samples. Your T3, T4, and TSH tests are going to be obtained through the blood. High TSH levels indicate hypothyroidism, and low levels of TSH suggest hyperthyroidism. And then as far as your T4, which is your thyroxine, a high blood level means hyperthyroidism. A low level is going to mean hypothyroidism. And then in some cases, high or low T4 levels may not mean that you have thyroid problems. How it's affected, those taking oral contraceptives, their thyroid hormone levels will be higher. And then patients with severe illnesses or using corticosteroids, um, their T4 levels are going to be lower than normal. To determine abnormal levels of thyroxine hormones are ultrasounds and thyroid scans via radioactive iodine uptakes. Ultrasounds are used to look at thyroid nodules or lumps found in the neck, and ultrasounds can determine whether the nodules are more likely to be cancerous. So if you look on these images, one's going to be an image of the ultrasound, how the test is kind of done, and then through the imagery, they're going to see if the nodule is going to be benign or suspicious. If you can look up top, the suspicious ones is kind of like more little lumps. There's like more dots within it, meaning it has more likely to be cancerous. Thyroid scans via radioactive iodine uptake. Healthcare professionals use thyroid scans to look at the size and shape and position of the thyroid gland. For this test, they use a small amount of radioactive iodine to help find the cause of hyperthyroidism and check for thyroid nodules. To evaluate the thyroid gland, a patient can be given sodium iodide that contains radioactive iodine 131. Iodine 131 is taken up in the thyroid gland and it emits radiation. It produces an image in a thyroid scan, which is then used to determine the condition. So if you look at the image, because of the radioactivity of the iodine 131, you can see like it kind of glows, and from there they can determine the shape. How to treat hypothyroidism in adults is through the medication levothyroxine. Levothyroxine is a synthetic T4 hormone administered by an oral pill, and it's absorbed by the gastrointestinal tract by 70 to 80%. Peak absorption is achieved at least 2 hours after oral ingestion, but it could take longer by 3 to 4 hours if taken with interfering foods and medications. Over and or under treatment with levothyroxine may have negative effects on growth and development, such as cardiovascular function, bone metabolism, reproductive function, cognitive function, emotional state, GI functions, and glucose and lipid metabolism. The dose of levothyroxine should be titrated slowly and carefully to avoid the side effects listed. And then TSH levels should be monitored yearly to avoid overtreating levothyroxine, which can result in hyperthyroidism. So basically, take too much of the levothyroxine just to treat it, you could end up with the opposite effect of having hyperthyroidism. Hyperthyroidism is treated with radioiodine therapy and antithyroid medication. This antithyroid medication is called methimazole. It's an antithyroid agent that is administered orally and absorbed from the GI tract. Peak absorption is achieved rapidly from 15 minutes to hours. It can be like multiple hours. And methimazole inhibits the synthesis of thyroid hormones. The most serious potential side effect of methimazole is agranulocytosis, which is a condition that can cause an extremely low white blood cell count. To treat thyroid cancer, high levels of thyroxine hormone are used to shrink and kill thyroid cells. Radioactive iodine 131 can be given by mouth or pill or liquid form and is absorbed by the GI tract. The radiation from iodine 131 destroys cancer cells in the thyroid gland within a few days. Maximum benefit occurs 3 to 6 months after treatment. This therapy is very effective. It is abnormal for second and third treatments. Here are my references for my presentation. Thank you for joining me, and this was my signature assignment of thyroxine.